Are you facing challenges in your health? Then Dr. Suleiman Clinic and Labs is here to provide you with the lasting solutions to your health problems. Dr. Suleiman Clinic and Labs is specialized and offers consulting in psychiatry, internal medicine, cardiology, urology, dermatology, gynecology, infectious diseases, and infertility. At Dr. Suleiman Clinic and Labs, we offer 3D/4D scan at just 5,000 francs, emergency ambulance, free ultrasound scan, and free medical consultations. Our staff is composed of well-trained doctors with good laboratory and best equipment. We are located in 2 cities, Boya at Mile 18 Bolifamba, and in Douala, we are located at Entree Pilot. You can reach us through the telephone number 694-940-172. Your health is at the right place with Dr. Suleiman.
Good morning, and how is everybody out there? Welcome to a new show with Dr. Solomon, Your Health Today with Dr. Solomon, my media brand. Today we're going to talk about something that is very interesting. We're going to talk about the heart and different kind of heart conditions. And we will start our session by showing the first video, and we will see that heart condition normally affect older population. In this video, we will see that it affect also younger population. Let's share the first video, and then we'll discuss the case together. All right, it seems like we're going on to share the first video very soon. Anyhow, till he gets the video ready, we should be aware of the signs and symptoms that we should recognize when we have a heart condition. Most of the cases complain about fatigue, especially when they do a little bit of effort. When they do small exertion, they have fatigue and sometimes chest pain. That is the most common scenario. I walk a little bit, I feel tired. I cannot continue, especially when they are going uphill, meaning when they are going to put a little bit of effort to walk. Chest pain is also a very common scenario. Palpitation sometimes is also very common. We're gonna differentiate different kind of scenarios today, and we'll discuss each one individually. So not everybody who's old get a heart condition. Those who are young also get the heart condition. Can we please share the first video? All right. So let me give them a few minutes. So this patient that you will see shortly came in after intensive investigation somewhere. He still have the same problems, which basically tiredness, fatigue, especially when he does the smallest effort. He gets tired quick. So we did all the heart investigation. Basically, the heart investigation is 2 things. One, to measure the electrical conduction to the heart, which means the impulses going to the different chambers of the heart is measured by an equipment called ECG, or electrocardiogram. And once we see what is inside the electrocardiogram, that will give us like kind of a roadmap that only tells us the electricity problems, the conduction problem of the heart. The heart has its own generator. It doesn't need electricity from anywhere else. It can beat in its own. We have what is called AV node, and then we have the SA node. The SA node is the generator of the electricity. The AV node is the regulator of that generator. So the heart can beat in its own without, even if you take the heart out of the body, it will still beat by itself. Why? Because it generates its own electricity. So conduction problem of the heart could be like we call it bundle branch block. It could be a complete bundle branch block or incomplete bundle branch block. What does that mean? It is not really relevant to know the medical terms. Basically, what you would feel is tiredness all the time, especially when you do the smallest effort. Sometimes you are pale, but if you have the blood color, you will not be able to tell easy if you're pale or not. But looking at the mucosal membrane inside the mouth or so, you will be able to tell, or even look at the eye color, will you be able to tell if you're pale or not. So the most common complaint in this case is fatigue. We have two kinds. The ECG will show us two kinds of things that we should be looking at. We will see what is called left axis deviation, or in simple English, the left side of the heart is big. The left side of the heart is big. That big left side could be one of two things. Either the muscles are increased in size, or there is volume overload. Yeah, this is the first video, yes.
So, yeah, tell me a little bit about your history. What happened? Why are you here?
Yeah, I always. At first, I was not feeling tired, but when I want to climb
Yes.
any hill or do any exercise, I feel very tired.
Yes. Okay. And have you been to another doctor before?
Yes,
What did they tell you?
that I have some condition in my heart.
Yes.
They tried to do some diagnosis.
Yes.
I was not that comfortable with the result, so I come for another opinion.
Okay, I understand what you're saying. All right, so now we're going to do an ECG. We're actually doing an ECG for right now. And please, Esther, give me the results. And as the ECG machine shows, you can bring it in front of the camera here. You can show it in front of the camera. Just, yeah. So well, maybe you guys not going to understand what that. It's okay, I'll talk about it. So we have global ischemia, especially to the anterior part. Ischemia meaning the anterior part of the heart is not getting enough oxygen. And the ischemia is the step that precedes heart attack. So he came already at severe global ischemia to the anterior of the heart, extensive ischemia to the anterior of the heart. He has been to another place, but I'm surprised why they didn't give him something for that.
Okay, so this is the first thing we do for the patient who complain about fatigue. Normally, chest pain. Normally, this is a 33 years old patient. Normally, this young patient, when we do the investigation, it turns out to be gastric. Most of the time is gastric. But let's not confuse gastric with heart. Anybody who comes with chest pain, we have to be 100% sure it is not a heart condition, like this young patient here. This is a young guy. So when the ECG, which is the electrocardiogram, it shows me, it shows me the size of the left side of the heart, the size. Okay, the size in this case was large. It says left axis deviation. And also we have right axis deviation. We have both. And it shows me ischemia. Ischemia meaning the coronary artery that feeds the heart is no longer feeding the heart enough. The heart is a muscle. Each muscle to work, it needs blood supply. And it happened to be that the heart is supplied by some arteries called coronary arteries. If the coronary arteries does not supply enough blood to the heart, we will get something called ischemia of the heart. We have three main coronary arteries that supply the heart. We're not going to get into details of those coronary arteries. But what can happen to them that minimize the flow of the blood to the heart? Number one, atherosclerosis. Atherosclerosis meaning basically narrowing of that coronary artery that feeds the heart with blood because of maybe too much cholesterol, especially if you are diabetic. If you are diabetic and you have too much cholesterol in your body, the sugar does not really mix very well with cholesterol. When those two components mix together, we form something that is very solid. It's very solid, cannot be removed, and it cannot be dissolved with medication. The only way we can fix this problem is if we do a stent. We get a pipe and we put inside the coronary artery, so we can bypass that solid material that is formed between cholesterol and sugar. So if you are diabetic, the first thing you should check is your cholesterol, because you don't want this deadly mix between cholesterol and sugar. That is number one. Now, it will be really very difficult for you if you have the combination of diabetes and a heart disease. That is very difficult. And believe it or not, this is the complication of diabetes also. When we have too much sugar, too much cholesterol, the reaction between the two caused me something called atherosclerosis, which is solid material deposited into the interior of those arteries, and that compromised the blood flow to the artery. We're not going to get into too much details, but more than 50% stenosis or more than 50% narrowing of those arteries will definitely limit my flow of blood. Now, let's focus on this young patient. Let's focus on this young patient. It happened to be he is not diabetic. He doesn't have diabetes. So we're dealing with a heart condition as the ECG shows. The ECG tell me that we have ischemia. We explain how can you have ischemia. One of the reason is those deposits on the walls of the arteries that feed the heart with this fatty material that is called cholesterol that deposit there, and then it gives me diminution, less flow to the heart, and the heart will the patient will have ischemia, global ischemia, or the leads of the heart that I put from the ECG will tell me exactly what area is ischemic and what area is not ischemic. For this patient, we have anterior extensive ischemia to the heart. So this patient then has to go in medication immediately. Once I find this, I have to give the medication, something called clopidogrel, or even a small aspirin to prevent any further complication for this patient. This is the first step that this patient has to take, unless there is limitation or contraindication for using aspirin for this patient. But 81 milligram will not hurt. The minute I see ischemia to the heart, the first thing I should be thinking about, this patient should be on aspirin, or the better version of aspirin we call clopidogrel. This patient should be on this immediately. That is number one. That's why I asked him, you have not been prescribed anything? He told me not yet. He was not convinced, or maybe he did not believe he had a heart condition. He wants to seek a second opinion, because heart condition, we normally know, like I said before, it happened to all people. Young people don't usually get a heart condition. Most of the time when a young patient comes and complains about chest pain, most of the time, 90% of the time, is gastric pain, is because of gastric, not heart condition. But this patient was the exception for the rule, that this patient has a heart condition. So the ECG showed me two things. Ischemia, we already have discussed what can cause ischemia and how can we deal with ischemia. Now, the second condition, it shows me LVH and RVH, which is left ventricular hypertrophy. The ECG will tell me axis deviation. It could be right axis deviation, which represent the right ventricle. It could be left axis deviation, which could represent the left ventricle. In either case, when we say axis deviation in simple English, I understood already that the left side of the heart is enlarged, the right side of the heart is enlarged. The second thing that comes to mind is what kind of enlargement. Enlargement of the heart could be because the muscles of the heart are too thick, or the muscles are not thick, they are normal thickness, but they are overstretched, and that heart is full of blood. So two meanings of left ventricular hypertrophy. It could be because of volume overload, or let's be more correct, left axis deviation could be either volume overload or either very thick wall of the heart. I always teach my young doctors that when you see the ECG is the first step you do. When you see axis deviation, you have to verify, is this thickness of this large chamber of the heart, is it because too much blood is inside, or is it because the walls of the heart are very thick? This require a treatment, and the other case require totally the opposite treatment. If we make the mistake and give the treatment for the guy that has a thick walled heart, the treatment for a dilated heart, the patient most likely to go into a lot of complication and die possibly. So we have to be very careful in distinguishing which left axis deviation means. Is it volume overload, or is it thick wall of the left ventricle or the right ventricle for that matter? But the chamber that really works, the most important chamber of the heart, is the left ventricle. This is what pumps the blood, and this is what is most important when it comes to the heart, the left side of the heart. Now, so this patient has axis deviation. So how can we tell whether the thickness, the enlargement of that left side of the heart, is it because the walls are thick or because of muscles, thick muscles, or is it the deviation, the left axis deviation, because too much blood is inside? So we call it volume overload. Overloading meaning is more than the usual load. That is what overload means. So we have to distinguish now, because as I said, volume overload has one specific treatment. Hypertrophy has totally the opposite treatment, and is essential to know which category the patient falls into. That's why we're doing those tests, to decide what medication to give. You cannot, as a patient out there with a heart condition, go to a doctor and the doctor does not do the ECG or the following step, which is, if I see axis deviation, I must follow this ECG with something called echocardio to see whether I have a volume overload or thickening of the left ventricle wall. If the doctor, or you go to a center, whatever for you out there, and does not do the ECG followed by echo, do not take medication from this doctor, because he can give you a medication that totally not for you, and it can cause you a lot more complication and a lot more damage to that already damaged heart.